Dr. Chris.Mazoue of USC's Department of Orthopedic Surgery has been a great source of guidance for us on helping our kids stay healthy and safe while participating in the athletics through the pandemic. Chris, school is just about finished. Can we start to speculate on full fall sports without any adjustments for the pandemic? Are we looking at football practices just like usual in August? Maybe?
Yeah, I certainly hope so.
Okay.
Speaking with experts around our state and DHEC leaders and our South Carolina high school leaders, assuming the direction continues that we're heading in, I think we can anticipate all sports in the fall that should start at the times that they have previously started in the past, and full participation. Now, obviously, that may change
Sure.
based on what may happen with COVID-19. Certainly, you're going to see some changes, compared to before COVID. Meaning, we're going to be a lot more aggressive with sterility in our locker rooms and around our schools. Washing hands, sterilizing equipment. So I still think that we're going to see those types of things in play. We're going to have to be aware of any student athletes that may become infected and obviously quarantine them. But I anticipate that we will see much more normal fall season.
Your specialty, of course, is orthopedics. Did we see any change in the kind of injuries, more or fewer, during this past kind of school year? And is there something positive that may come out of what we went through from an orthopedic standpoint?
Yeah, I think that's a great question. So we don't have the data yet to be able to say whether or not we saw more injuries.
Okay.
I'll tell you that talking with sports medicine colleagues across the country, there was a sense that we saw some additional kind of knee ligament injuries and things like that, maybe because kids weren't quite in shape. But I don't think we can say that scientifically quite yet. We're still getting the data. With any time you have something like this, you gain knowledge and wisdom. And so we've learned a lot about cardiac conditions associated with viruses that we're going to use in the future to help us get better and take care of our athletes better. Obviously sterility issues, we've learned a lot about that. And so, and it caused kids to grow up a little bit, become a little bit more mature about this. And so I think that there are some positives that are going to come out of this.
For these maturing kids, it is now, we're getting ready to start the summer season, which is where you get ready to play in the fall. Recommendations for kids thinking about how do I get in better shape, as you talked about earlier, to go get it when fall season comes around?
Yeah, I think you need to start preparing now if you haven't been, for sure. Certainly for a lot of our athletes, they need to get in the weight rooms and they need to be working out in the weight rooms. They need to be out jogging and running and doing agility drills. We had some conversation about stretching. Stretching before exercise is important, whatever that sport may be. There's a concept of dynamic strengthening right now that you can look up on the internet, like a lot of things that has kind of become the preferred way of stretching.
Okay.
And so start working out now. You need to start preparing now for August and September and October.
It'll be here before we know it. Thanks so much, Dr. Mazoue. Chris.Mazoue of USC. Appreciate you joining us. Up next, we'll hear from Airports Director John Rembold on all the buzzing, literally, around the Hilton Head Airport these days.